Thank you very much, Chris. Thank you again to ODI for hosting the event and for Age International and Page International together to work on this on today. So I will do a presentation that will cover some of the content that is in the report we are launching today and just give you some background of why aging is a significant trend to be included and considered in DRR. Am I working this one? Just like this, yeah. Okay. So aging is one of the population dynamic in trends that is happening now, but it is a very significant one. So obviously we are looking at an increasing number of people overall, still population growth, urbanization, migration as other population dynamic trends, and aging a significant one. And I'll give you some very quick data which Chris has in part introduced. But so that's a trend to be understood, and of course within a context that you probably know all very well of an increased exposure to disaster that communities are exposed to due to climate change, to the increasing complexity that of economic development and the environmental damage and resources, scarce resources. So this is to illustrate, the two graphs will illustrate the process of aging from 2014 today to 2050, and everything that from green turns red means that is going through a process of fast aging. From green to red, you have the percentage of all the people in that particular country or region, with the green under 9%, moving yellow to 20%, over 25% next, and then between 25 and 30 and over 30. So this is illustrate that the aging is a global phenomenon. It doesn't affect only the developed world, and in fact, it is affecting across the world all countries. And the important things of this graph is to understand that if you look at not just the percentage, but the numbers in Asia, Africa, and Latin America, you will see that we are talking about a tripling number, almost tripling number of all the people. So in Africa, we are talking about 61 million of people over 60, which will get to 211 million, which is the number of all the people, or more or less, that is in Europe. So we're talking about a significant proportion of the population also in very poor resource countries. But of course in Asia and Latin America, the process is even faster. And this is to illustrate the time that has taken the developed or Western world to aging. So you look at the UK, 40 years to go from 7% to 40% of 14% of the population, and another 40 years to go from 14% to 20%. If you look at a place like Bangladesh, that first 40 years are reduced to 23 years, and the trend is continuing, is even more rapid aging process. So only 10 years for Bangladesh to go for a 14% of the population to 20%, which has implications for how the country is prepared and respond and start to take into account the aging process. This is to illustrate that the numbers of countries that go through a fast aging process, some of them in more specifically here, are also countries that are considered very vulnerable to disaster by the DARA indication of acute situations. So Vietnam, Thailand, they almost triple their population. This is in 20 years, by the way, by 2010 to 2030, almost triple the population of over 60. So it's another indication of the rapidity of this process. However, we got to obviously look at this situation not in a kind of catastrophic and worrying necessarily process is about how do we take this into account, how do we prepare for this, and how do we start to put the right framework in place to ensure that older people are integrated into disaster, and indeed, as has been mentioned, are enabled to act as a resource for disaster risk reduction. Everyone that is over 30 today will all be in that category by 2050. So we are all heading in that direction. Okay, so some very very important facts which have already been mentioned, but it is important that to look at them, because I think for us we're the first. Finally is obviously a negative, but finally the implication of how disaster affect people in old age came out very clearly in Katrina and the tsunami in Japan. 75% of casualty in Katrina were over 60, when there is where 16% of the should have been, if it was proportionate, only 16% of the population. And in Japan, similar, 56, when it should have been 23% of the population. So disproportionate number of deaths for the group, which means that it is the systems and the way in which we respond to disaster is neglectful in relation to older people. And perhaps because the vulnerability of the older people is not fully understood or considered, and there are different elements to it. There is a poverty element, which doesn't affect only older people, but there are additional vulnerability in old age, especially in places where there is no pensions or no system to protect people in later life. Neglect, isolation, disability, double care burden, as many older people in contexts where we respond, that often the responsibility of looking after children and grandchildren or other older people, spouses, as well as needing care themselves. And the psychological distress and the time, and we have evidence from a number of situations where we have disaster situation, we have responded. At the time it takes for people in later life to recover psychologically for a major disaster or a humanitarian crisis is longer than other groups, population group. So specific needs, the specific needs of older people are in area that you would have expected, but perhaps is to a bit more in depth for it. Health is obviously an important one. There is still a very limited understanding of the specific health condition and the necessary response that is important to put in place. For example, the non-communicable diseases. How do we ensure continuity of treatment in humanitarian response? How do we prepare system to ensure continuity of treatment of NCD, of non-communicable diseases? For example, nutrition, specific assessment of how you assess the nutritional situation of older people, the specific foods that you need to be prepared to have in your response, and of course the mobility and the potential isolation, that frailty, loss of hearing, and other aspects of old age, how they can increase that vulnerability. So. But as I said, we are also been working very closely and looking at how we can support all the people to actually act as an active active response at DRR and community organization. So I'll come back to that. We are looking at. I'm going to skip. Yeah, we're looking at older people knowledge as a very important aspect of the contribution that older people can make, and there is more research and studies that is looking in with greater with great rigor of the importance of this knowledge and how this knowledge contributes. So there are different types. There is a life experience knowledge. So if you have got to an old age, you have been a pretty resilient individual, especially if you've lived through a number of disasters. You have accumulating a learning and a capacity to understand the context in which you have lived and how you respond to those contexts. There is a traditional knowledge and an indigenous knowledge which are on a continuum. Indigenous knowledge is obviously more ancestral, is depending on the culture of, and traditional knowledge is passed through the stories, the understanding of the communities of how you respond to disaster. So they're similar, although they have a slight difference there. And increasingly, this indigenous knowledge and traditional knowledge, particularly, have been looked as part of as a contributing to the more scientific assessment of risks and how you respond to those risks. And they've been particularly useful as a way to correlate certain forecasts, for example, as a way to model response. For example, in Kenya, the Met Office is currently working with the elders now. We have a way to predict what's happening in the upcoming season, and they cross-reference with their forecasting. So systematically integrating the older people knowledge into early warning and DRR systems. So we find that particularly important area to continue to work on. The other aspects, obviously, is to consider the position of older people in the communities before the disaster occur, and older people often have a sense of, in many communities, are authoritative and can mobilize other members of the community. They can understand social tensions within the community. They can operate in that context as negotiator or mediator during social unrests. And they can obviously can also maintain sorry. So this is the main area actually. Sorry, cover here. So. We have a significant experience at El Page in really looking at how you support older people so they have this knowledge, they have this position in communities, they have all this potential. How do we actually mobilize this potential? And the experience that we have had is through the development of older people associations. And older people associations are very community-based organizations that bring together older people, sometimes older people and other members of the communities, and they do a number of activities, including disaster risk reduction. And they've proven extremely effective in creating a level of awareness and in the ability, we were looking at the White Brigade as one example of mobilizing fast the response. In the publication we are launching today, a lot more detail is given about how the vulnerability and the contribution that older people can make can be used in early warning, in first aid, in search and rescue, psychological support, evacuation, stockpiling, detailed needs assessment. In fact, just give you a brief example of the Philippines, where I've been able to visit two or three times after the disaster, and really the role that older people themselves played in the support provided to other older people who were affected by the disaster. So mobilizing older people to support other older people to access, for example, medical services, to support them through that very difficult immediate after the disaster access to the services was extremely effective by doing it, from older people to older people. So these are the guidelines, and you have it on your seat there. They are exploring. They provide the background in terms of the knowledge and experience and the evidence that exist, and they provide practical checklist of how to take this forward. This is the area they are covering, which I mentioned already. There, and perhaps the one thing I didn't mention up to now is that they are looking. The guidelines cover disaster risk reduction, but they also look at the resilience of systems. And when we're looking at the resilience of systems, again, in the case of the Philippines was one case in point. It's just because it's a recent disaster where there was a pension or an old age allowances that existed for people in the Philippines, but straight after the disaster and for the next 6 months, that was suspended. The system were not there to keep that pension coming, and in fact there were potentially other reasons why the pension, the local authority did not have the funding were diverted in other, so there were all reasons why the pension was not delivered, and it's a real shame not to be ready in a situation like the Philippines to continue a pension which was particularly vital for people who were in a very difficult position. So that's an example of a system that needs to become resilient, able to continue after disaster like the Philippines. But similarly, you have climate smart agriculture. Again, the Philippines was looking at what kind of palms you need to plant with and so forth. Livelihoods, more generally, macrocredit. Obviously, this is just to share with you that in addition to the publication we are launching today, L-Page, and this is a bit small, but you might not be able to see it, but has developed guidelines in a number of specific areas for humanitarian response, which obviously are relevant to the disaster risk reduction, the preparation in health, nutrition, livelihoods, needs assessment. Those are the main one, and on displacement, actually. And let me just actually on displacement give you another. This is another area which is very. There is increased evidence of how it's important to consider after or during any disaster how all the people are affected by displacement, because the evidence that we have had collected, for example, in northern Uganda, in Colombia, is that all the people are often left, they often don't displace with the rest of the community, which means that by the time that they're displaced on their own, and the package that need to be put together to support that displacement are different from the family package that you give to family. And of course you have to consider also the risk they putting themselves under by being the last one to be displaced. So what kind of resilience needs to be built and then similarly when the camps are closed, and this was the case, so the first one was the case of Colombia, that all the people were displaced in a lot later, and the case of northern Uganda, once the camps were about to be closed, the only people left in the camps were all the people, because they were not able to return. So in terms of the displacement is a particular area that needs to be looked with specific needs when you look at building resilience and DRR. And I'm coming to the last two slides here. Charter 14 is what we are launching today with the publication, and we're very pleased to see that already with UNSDR, a number of countries have already signed up. 5 countries at the moment, five governments have signed up to Charter 14. It's 14 clear steps for integrating all their people into disaster risk reduction. But I wanted to leave you with not a sense that, this is the guidelines, this is all done, fantastic, it's just a matter of implementing. There is obviously a number of areas that need further research, further understanding of how better we can look at both respond to the vulnerability of all the people and build on the capacity that they have. And for example, obviously I mentioned NCD. It's an area that we still work in what preparation needs to be put in place in population that have an increased number of people with non-communicable diseases. The traditional knowledge question, how does that correlate with the more objective scientific approach? What more can we identify there? The whole area more practical of rescue, search and rescues. Obviously, there has been a number of very important steps that we are taking with integrating disability, for example, in disaster risk reduction, but that doesn't cover actually all the needs of all the people, for example, mental health issues and a number of others that might affect the way in which you are running your search and rescue. So those are areas that, and I'm sure there'll be other that could be identified that need some further exploration. Thank you very much.
Thank you, Silvia. I should have mentioned earlier, when we come to time for discussion about the charter, about the report that Silvia's introduced us to, one of the authors of that report, Claire Harris, is with us from HelpAge and will join the panel to respond to questions that may be asked at that point. But before then, Tom Mitchell is Head of Climate and Environment Programme here at ODI, and we invite you now to make some comments, perhaps putting this year's theme, Resilience is for Life, in the broader context of disaster risk reduction work.